Welcome. And we are here at National Government Services where the focus of today's YouTube video will be on Advanced Primary Care Management Services, or APCM. Thank you all for being with me today. My name is Carlene Parker, and I am a consultant here at National Government Services, servicing the Medicare Part B providers in Jurisdiction 6 and Jurisdiction K. I come to you today with over 4 decades of Medicare experience, and I hope you find this YouTube video informative and helpful. National Government Services has produced this material as informational reference for our providers furnishing services in our contract jurisdictions. National Government Services employees, agents, staff make no representation, warranty, or guarantee that this compilation of Medicare information is error-free and will bear no responsibility or liability for the results or consequences of the use of this material. Although every reasonable effort has been made to assure that the accuracy of this information within the presentation at the time of publication, the Medicare program is constantly changing, and it is the responsibility of each provider to remain abreast of the program requirements. Any regulation, policy, and guidelines cited in this publication are subject to change without further notice. Current Medicare guidelines can be found out on cms.gov website. Advanced Primary Care Management Services. Advanced Primary Care Management Services, or APCM, began in January 2025 for physicians and non-physician practitioners, allowing them to bill these types of services. The Advanced Primary Care Management Services are primarily for primary care specialties like general internal medicine, family medicine, geriatric medicine, and pediatrics. These services allow physicians and non-physician practitioners to provide patients with a wide range of services to meet their individual needs based on complexity. It allows them to bill the services using a bundled payment instead of billing each individual care management and recording minute by minute. These services will help simplify your billing and documentation requirements while ensuring that the patient has access to the high-quality primary care services. Advanced Primary Care Management Services combine the elements of several existing care management and communication technology-based services that you may have already been billing for. The APCM is a patient-focused approach to healthcare that emphasizes on coordinating continuous care for individuals with chronic conditions. It expands the traditional primary care by incorporating more proactive management strategies, including detailed care plans, regular monitoring, and enhanced communication, coordinating care between the patient and other healthcare teams. APCM is patient-centered care delivered in the home, community, and it is addressing the need of individuals with functional limitations who need assistance with everyday activities, helping people stay in their homes instead of moving into a facility for care. And last, Advanced Primary Care Management accounts for patients needing intensive care management due to the chronic conditions or social risk factors. Unlike the standard care management already in place, principal care management, chronic care management, transitional care management, the advanced primary care management is a proactive care approach for a broader range of patients, including those with stable conditions or fewer conditions. Individual care services that we talked about, the principal care management, chronic care management, or transitional care management, they all have time-based billing requirements, right? Where you need to document every minute you spent on the care management. And you must meet the certain threshold for to bill monthly for those services. The advanced primary care management services are not time based, and it allows you to bill these codes once per month, but it will be important that you meet the billing requirements, and we'll talk about that shortly. The key differences here. So, the advanced primary care management model represents that development of care management programs, right? Integrating elements from several existing initiatives while introducing new features. So, although other care management services involve care planning and coordination, advanced primary care management typically involves more in depth data management and performance measurements. So, by providing that proactive and coordinating care, the advanced primary care management can lead to a better management for the chronic conditions. It will reduce the hospitalizations and improve individual overall health. So, advanced primary care management expands the chronic care management scope to include patients with fewer chronic conditions and simplifies that billing with a single monthly payment instead of time based billing. And then with chronic care management codes, APCM cannot be billed concurrently. So essentially, the advanced primary care management services replaces the existing, but it expands on care for an individual. So the advanced primary care management also includes that care transition, potentially reducing the need for separate billing, right? So patients benefit from increased access to healthcare team, personalized care plans with a more proactive approach. The CMS Advanced Primary Care Management team would involve the multidisciplinary group of healthcare professionals, all working together to provide that comprehensive and coordinated care for patients, particularly those with a chronic condition. Key members of the team would include the primary care physicians, your nurse practitioners, your physician assistants, your registered nurses, your care managers, social workers, or behavioral health specialists, and also your administrative staff, right? So, this team approach ensures that the patient is receiving the support they need across medical, social, and behavioral health domains, promoting better health outcomes and improved patient experience. So, physicians and non physician practitioners will be responsible for the primary care. Direct clinical staff will be there to serve as a continuing focal point, and the conditions must be expected to last at least 12 months or until the death of the patient. And these are illnesses that place a patient at significant risk of death, acute exacerbation, decompensation, or functional decline. And once again, that team approach ensures that the patient receives the support they need across all medical, social, and behavioral health domains, promoting better health outcomes and improving patient experience. Let's talk about auxiliary personnel when it comes to the advanced primary care management. So, auxiliary personnel can provide services, but under the incident to. Incident to the professional services of a provider who bills the initiating visit, right? And associated advanced primary care services. So the APCM is designated care management services and auxiliary personnel will work under the general supervision. And auxiliary personnel means an individual who is supervised by a physician or other qualified healthcare professional. And the billing provider performs the services and oversees that plan of care. So auxiliary personnel can be employee, leased employees, independent contractors of the billing provider, must not have been excluded from the Medicare, Medicaid, or federally funded healthcare programs from the Office of Inspector General. And more importantly, their Medicare enrollment has not been revoked. Also, in order to bill APCM, providers must meet any applicable requirements to furnish Incident to services, including the licensing that is imposed by the state in which they provide the services. Let's move into the billing and coding requirements for APCM. First, this is a tiered payment account for patients needing intensive care management due to chronic conditions or social risk factors. So very important to note here, clinical staff may provide advanced primary care management services by a physician or qualified healthcare professional who is responsible for the primary care, directs the clinical staff, and serves as that continuing focal point for all healthcare services. So these conditions must be expected to last 12 months or until the death of the patient. It places that patient at significant risk for death. We talked about this: acute exacerbation, decompensation, or functional decline. You have your G0556 HCPCS code, which is Healthcare Procedure Coding System, which will identify one or fewer chronic conditions by clinical or auxiliary staff under the direct supervision of a physician or qualified healthcare professional. G0557, two or more chronic conditions by a physician or qualified healthcare professional directly. What's important is G0558 for qualified Medicare beneficiaries. So two or more chronic conditions who are qualified Medicare beneficiaries. And this would be a combination of care by a physician, qualified healthcare professional, and or auxiliary staff. Note, all services, including all the billing requirements listed over the next series of slides. So there will be some billing requirements, right, with all services under the Medicare program. Providers billing advanced primary care management will be responsible for the patient's primary care, servicing as that focal point for all the patient's healthcare needs. Providers shall complete certain elements when they're clinically appropriate for each or an individual patient. So once again, comprehensive care plan management. It will create support system to help the patients properly manage their health conditions, to gain a better health stability. It will overall improve well-being and even attain a higher quality of life for your patients. So let's talk about the elements. You see a blank screen here. Let's talk about them each individually. So the billing requirements will involve comprehensive care management. It will involve development, implementation, revision, maintaining an electronic patient-centered comprehensive plan of care, coordinating care transitioning, coordinating practitioner, home health-based care, provide enhanced communication opportunities, and measure and report performance measurements by providing access to care 24/7 continuity of care. Let's talk about each one of these. When you conduct the initial visit, this is required for new patients or those that have not been seen in 3 years. Visits may be paid separately for new patients as well. And you don't need to conduct this visit if you or another provider within your practice has seen that patient within the last 3 years. Now, provide another care management services, right? Provided that you've provided other care management services to the patient within the past year. So if you've done that, want to move towards APCM, that may be done because this is a more comprehensive care management. So let's talk about the comprehensive plan of care. This is where you're going to engage in resources, intensive processes outside of your office, which would include conducting systemic needs assessment, ensuring preventative services are being received, medication reconciliation, and oversight of self-management. The plan must outline all necessary services by addressing identifying needs such as pain and symptom management, medication management, and support psychosocial and spiritual needs. Communication among care team members ensures that the care is aligned with that patient's goals and needs. So as we move right along to coordinating practitioner home and community care based services, this would be provide ongoing coordination, communication, and documentation on the patient's psychosocial strengths, functional defects, the goals, preferences, and desired outcomes from practitioners. The home, community-based service providers, community-based social service providers, could be hospitals, skilled nursing facility, and other types of ancillary services. We'll move right along to coordinating care transitions because this will coordinate the care that ensures a seamless delivery of services across different healthcare settings, right? Let's talk about conducting the patient population level management. So, this will analyze patient population data to identify gaps in care. It will identify risk in the practice population based on defined diagnosis, claims, or other electronic data to identify and target services to certain patients. Let's talk about development assessment. This process begins with a thorough assessment of the patient's physical, mental, social, and functional needs. That's where the multidisciplinary team comes into play, and it will involve the patient attending physician, nurses, social workers, and other relevant professionals who work together to develop that plan of care. And the plan of care should include personalized goals tailored to the needs and preferences of an individual patient. The plan of care should also involve the patient, their representative, their primary caregiver, all important in that planning process, right? The care plan should be easy for the patient and caregiver to understand. Now, the plan of care must be available within and outside the billing practice as appropriate to individuals involved in that patient's care. So members of the care team must be able to routinely access and update their plan of care as well. Always give a copy of the plan of care to the patient or the caregiver. Let's move right along to the top right-hand side. Get patient consent. So inform the patient, obtain that consent, and document that consent. The practitioner assumes responsibility for all the primary care services. Moving right along to maintaining and ongoing enhanced communications. So with this, you want to communicate and document the communications with specialists, community health providers, manage the referrals, social needs assessments that enable secure messaging through email and or a patient portal. So you want to offer that asynchronous, non-face-to-face consultation methods other than phone, like that secure messaging, the email, internet, or the patient portal we talked about. Be able to conduct remote evaluations of pre-recorded patient information and provide interprofessional phone, internet, or electronic health records referral services. Use patient-initiated digital communications that require a clinical decision, like virtual check-ins, digital online assessments and management, and evaluation and management visits, all important. Let's talk about the measure and report electronic patient-centered performance measurement. This will include assessment of the primary care quality, total cost of the care, the meaningful use of certified electronic technology. So access quality, cost of care, using that electronic health record technology through the MIPS eligibility practitioner, which they can satisfy this through the value and the primary care or MVP. And last, providing access 24/7 for continuity of care. So provide real-time access to urgent care needs, including after hours, contact options via nurse call lines, answering services, partnership with urgent care providers, offer care beyond office visits, such as e-visits, phone visits, home visits, extended hours just to meet that patient care needs. So a lot of different elements and the requirements when it comes to the advanced primary care management you want to be aware of. Let's talk about documentation, because documentation is key, right? If you didn't document it, you didn't do it. We want our providers to be paid for their services. Therefore, providers will be required to maintain a comprehensive electronic care plan that is accessible with a problem list, expected outcomes, the treatment goals, cognitive, functional, system assessments, interventions, medical management, caregiver assessments, coordination and outside providers and periodic plan reviews. Your documentation for advanced primary care management must clearly demonstrate that the service provided was medically necessary and the patient's involvement. It should include details about interventions, coordinating, and planning along the way and how the service was delivered, phone, in person, portal. Documentation should also show patient consent, the comprehensive plan of care, the longitudinal, the ongoing communication are also essential. The plan should be revised to reflect the changes in the patient's physical, emotional, social well-being. All revisions, updates to the care plan should be meticulously documented in the patient's record. And make no mistake, you want to make sure that the documentation clearly supports who provided what, who provided when, who provided where, and who provided how. We thank you for taking time to listen to our YouTube video here at National Government Services. We want you to stay connected to us. We're all about learning here at National Government Services. We have YouTube channel. We have a podcast. Many podcasts. We have an online paced learning through Medicare University connected to LinkedIn. If you're not connected to us via our website at www.ngsmedicare.com, visit us today. Our provider portal is NGS Connects. Register for our provider portal to get all the eligibility information you need, because we have our interactive voice response system, but it does not contain eligibility facts and data. And if you've not done so, make today the day that you will sign up for email updates. My name again is Carlene Parker. I thank you for your time today, and please join us again for future YouTube webinars. We'll be here to help you. Have a wonderful day.